Dr. Son Young-mi of Egood Dental Clinic. The case that I'm going to do surgery on is a case where number 14, 15, 16, 17 are missing. If you look at the intraoral image, there's root rest in number 14 and 16. Implants will be placed in number 14 and 16 only. The key today is immediate implant placement in number 14. How I can get good primary stability will be of essential importance. If you look at panoramic image, there's root rest in number 14 and 16. It's unclear whether root rest of number 16 is 16 or number 17, but it doesn't really matter. Implant will not be placed in the root rest area, but it's going to be placed where number 16 is assumed to be. Let's look at CT. Number 14 is going to be very important. There's moderate level of bone resorption here, and there's a bit of destruction on the buccal plate. In terms of surgery, I'm going to extract the root rests in number 14 and 16, and one guide is going to be used to place the implants. And in number 14, GBR will be performed. Collagen membrane is going to be used for coverage, and surgery is going to be completed. In the case of number 16, implant will be placed, healing abutment is going to be connected, and surgery is going to be closed. Let's look at the surgical clip.
안 아프시죠? 네.
This was how surgery was completed. Then let's look at post-op images. One guide was used to proceed with surgery. On the panoramic image, you can see implants have been placed. The parallelism between the two are very good. However, if you look at the implant placed in number 14, it seems very close to number 3 root. If you look at CT and when you look at superimposition, it's not a problem. So this was how surgery was proceeded. If you look at CT on the buccal area in number 14, bone graft has been done nicely. The key is for this to become new bone. The hope is that new bone formation will occur nicely. In the case of number 16, implant has been placed nicely. What I want to mention today is that in this surgery, because of lack of time, I just received the STL file from center and printed it out at my dental clinic. I did not receive the printout from the center. And as you can see, compared with the template that is printed out at the center, the accuracy of what I've done falls. Yes, you can proceed surgery with it, but my recommendation is to use template that has been printed out from the center. In terms of surgical accuracy, it's better. We use one guide for accurate surgery. The 3D printer that is used frequently is insufficient in securing the desired accuracy. I would like to recommend you to use the template that has been printed out from the OSSTEM center. You can see that surgery has been done nicely despite of it, and the process of adapting the template was very difficult. Surgery was completed as shown. In the case of number 14, a GBR was done. Multiple sutures were used for adaptation. Yes, you can proceed with surgery without a guide. That is possible. What I want to highlight is that we often do GBR. When we look at the factors that affect long-term prognosis of GBR, do you think that the factor that comes into the play most significantly is the bone graft material and membrane we use? That's what many people think, but the most important part is that implant position needs to be ideal. Only then will we be able to utilize bone graft materials and membrane to the fullest. My opinion is that if implant position is not good, you'll not be able to get good results. In this case, one guide was used for the sake of patient's comfort and my necessity. If you come across a case where prognosis is in doubt, or it may be difficult to get primary stability, or perhaps you can use the one guide in cases where you need to place the implant deep, but you're unsure as to how deep you can go. By using one guide, we'd be able to proceed with surgery with more confidence. This is the end of the surgery today. I hope my technique and know-how will be of help when you provide your treatment to your patients. Thank you for watching.